Hold on, Miss Nancy. I remember saying, I'm sending it right now. No, I'm gonna give me a chair. That's gonna give you a chair.
You got it? It's up. It says John. Stop talking. I might be on audio.
Hold on. All right. All right. Can y'all hear me now?
On the audio.
Really?
Which one it is?
Hello, hello. Can y'all hear me?
Roll fried, don't like it. I know it's fine. Do you know what this computer on that was now? Maybe these speakers. Recording in progress.
Okay, can y'all hear me?
Hang on.
Okay.
Got an echo.
Can y'all hear me now? Is it still echoing?
That's better.
Okay, great. 1 second.
That's when I wanted to start. We was talking about what I heard was because I knew this was going to happen.
Okay. Hey, everyone. Thank y'all for taking time out of your day to come to orientation. So I will, at the beginning, ask everybody to mute your microphone just while I kind of run through everything. And then I'll unmute everybody and y'all can ask questions. And I'll stay as long as y'all would like to just kind of go through the basics of how it's going to work with y'all. A lot of the detail really is kind of going to be provided in the training after this, but kind of the overview of how it's going to be different this year from past years, and let y'all know that each one of y'all just needs to let me know whether or not you want to accept the contract, and when you do, you will provide me with the name of one of your team members that will be the reporter for your agency. You can have more than one reporter per agency, but we will just start off with one, and that reporter should also be the person that completes the training to have y'all certified. So one of the biggest changes this year from prior years is that we are moving to the STARS reporting system. And I don't know what that noise is. And all of your activities and consequently anything you will get paid for will be based on what you enter into STARS. Now, it looks like when we go to the screen and I show you what it looks like, that it is a whole lot of information and that it's confusing, but it's really, it kind of walks you step by step through every contact and every event or media activity that you participate in. You will enter it into STARS, and at the end of the month, I will go and run the report. You won't have to submit any invoices to me. You won't have to submit really any paper or anything to me. I'll run the report. I will send it out to y'all via email saying this is your units for this month, and you will get paid each month. So you're not having to wait on me to process invoices and accounting and finance to do their part at random times. I will go on the 10th of each month and I will run it for the previous month. Anything that isn't on that month yet, it'll just get paid the next month. So there won't be a big delay for y'all to get paid for the activities that you do. The other big difference this year in how we did it in past years is we kind of got dinged by ACL for not having statewide coverage and participation. So I know in past years we didn't really use the population or Medicare eligible population or any kind of formula to determine y'all's funding. And this year your funding was allocated based on the number of Medicare eligible clients that are in your region. if you choose to not participate, which is fine, the ADRC that covers your region will take over that region. But I really would love if everybody participated, and because things are kind of new this year. Number one, I will be available to y'all whenever you need and have questions about anything that you're doing to make sure that you're getting paid for everything that you do. In past years, the definitions of what kind of counted as a unit were, I would say, a little more limiting than the way that it's going to work moving forward, in that instead of having enrollment assistance be one unit and follow up to enrollment assistance and all the different kinds of contacts, you're going to get $100 per unit for every single beneficiary contact that you perform and enter into STARS. That really kind of runs the gambit of anything from phone conversation to messaging to email to anything. The only real limiting factor there is going to be that when you enter your contact, you have to kind of select the topic of conversation or the topic of the contact, and there's a whole big list of possible contacts with definitions, and so it's not going to be that. I don't think y'all will have a problem categorizing it, and it is everything from Medicare assistance all the way to health prevention and related topics. So pretty much, especially during open enrollment, any of the calls that you can at all link to being a beneficiary contact, as long as they're the right age, we are happy for you to enter it into STARS and get paid for it. I will also have monthly a really short kind of check-in with y'all, and I will send y'all a meeting invite just to make sure that if anybody is having trouble getting their units or doesn't know what to do to get the units, that I can walk y'all through it. We can figure out something. I'm extremely flexible and open to anything that y'all do that increases the knowledge, awareness, ability of Medicare beneficiaries and their representatives, families, whoever. All of that kind of assistance we want to capture in STARS and get y'all paid for it, and hopefully our performance moving forward will kind of get back to, we were in probably the top 15 states for a long time in terms of the number of people that we're reaching and statewide participation. And I know COVID had a whole lot to do with everybody not wanting to take on something extra, especially when you didn't have face-to-face contact. But hopefully we can get everyone trained, and the training, number one, you will get paid for both the one person at your agency that has to be trained, and then any additional people that go through the training, you will also get paid for that. And that way you're not having to spend hours of time that your staff could be doing something else, doing training. And I can certify y'all nationally to be, and y'all actually be called SHIP counselors. But it's one way that ACL can make sure that we are giving Medicare eligible beneficiaries up to date and correct advice, and that y'all are aware of all of the resources and options and tools that are there for y'all to use to help answer questions and find information and provide education to Medicare beneficiaries. So I will first go over the grant taxonomy just so that y'all can see the 3 units. And the definitions that are on here are gonna be kind of shortened from what guidance is provided in the longer kind of manual that that I attached. And I kind of break them into two. There's beneficiary contacts, and that's going to be your one-on-one assistance in every form it can be. And that's the $100 per unit for every contact. And once you start going through both the training and the instructions, and I'm also going to send y'all a job aid that's kind of a 1-page, this is what you enter where. You will see kind of some of the particular rules about, you know, what if the same person calls more than one time in a day? What if the same person calls and a different staff member handles them? There are a lot of scenarios where I think in the past you may not have been paid multiple times for the same client. And in this case, a lot of times, as long as it's, you know, not just one single phone call that, you know, was broken up 5 minutes apart, you'll actually get paid. You're not limited to just getting paid once per that beneficiary. All of the time that you put into it will be accounted for and paid. And, you know, even if you only spend 5 minutes on the phone with them, you know, you will still get your full $100 unit. The other two units, which are both $500 per unit, are more the kind of group and overall programmatic outreach components. So a group outreach enrollment event, which ACL shortens to GOE, so I'll call it GO, and then media outreach and education, which they call MO. The GO is, there are 3 sort of categories of group outreach events. The first is an interactive presentation that can be in person, video conference, web-based, Zoom, teleconference, in any way that you are providing specific educational content to a public audience. It can even be a recorded presentation that you did in the past, but presented to members of the public, you know, for purposes of providing that educational content. The one sort of requirement that ACL is really concerned about is that your presentations need to be interactive. And I don't mean that you have to have, you know, a game that everybody participates in, but there needs to be the ability for your participants to ask questions and someone available to answer those questions. If it's a recorded event and you are not there live to answer questions, you just provide them with a way to contact the person that can give them answers to their questions. So via email, and then the person that answers the questions just needs to follow back up with them in a reasonable time from when they submit the question. And that is 3 to 5 days normally. But, you know, as long as y'all are following back up on it and they have the ability to contact y'all during or after the presentation with any of their, you know, questions, concerns, or issues, you are good to go. The second kind is a booth or exhibit, which would be something like a community event, a senior fair, a health fair, and it's events where you're going to give the public program-specific information, printed fact sheets, or other distributed educational materials to the public. The purpose should be to inform the public about the availability of MIPPA services through your agency. So, for example, some contractors attend health or senior fairs and set up an information booth to increase the awareness of your parish that y'all are there. You can answer questions and help them find information as they're going through Medicare enrollment, or as they're picking their Medicare plan, or as they face issues trying to change a plan, or just any of those issues. It's, you know, you are letting them know that you are there for that. It can be in person or virtual, very similar to interactive presentation. The only real difference between the interactive presentation and the booth exhibit is that the booth or exhibit is really focusing on the public's awareness of you as a MIPPA provider, the information that you can provide them, and the other services that y'all provide, instead of just, you know, one specific topic about Medicare or one specific presentation about you know, low income savings plan information. And pretty much any sort of place that you go where you're distributing flyers or anything about your agency to, you know, more than one or two people should qualify under the booth or exhibit. The third category are enrollment events. This includes the type of program where enrollment is a key objective and team members are there to help beneficiaries come in and fill out the application and you know, go through the process to get them enrolled. And you can either, you know, have an enrollment event where it is just your agency alone, or you can have an enrollment event that partners with other agencies or entities. So you can partner with a senior center, you can partner with other AAAs, you can partner with, you know, community health organizations where you know there is going to be like the target population that y'all are looking for, and you know, that way reach as many people as possible. The other really good thing about an enrollment event is you can both get credit for the enrollment event where you are there saying, hey, we are here to help you enroll in Medicare, and for each person that you assist with enrolling in Medicare, you will also have a one-on-one beneficiary contact. So you can kind of like double up and maximize the reimbursement that you get for, you know, for each activity with spending, you know, the same amount of time. The second category of kind of the group or public units is the media component. And a media outreach and education activity is one in which general program or Medicare information. So this does not have to be solely about Medicare. You can also provide them with health prevention information or services that your agency provides information. And it's anything that you are sharing through a type of media. And the list of media is not inclusive. And it's not exclusive, I'm sorry. These are the main types, but if you look at the bottom, we have an other. So even if you don't see how you squarely fit within one of these other categories, you can still enter it through other. So, for example, if you send out an enrollment reminder or, you know, deadline reminder to all of your home delivered meal participants through Alert Media, that could be an other category or social media for each of those people that it's sent out to. And that would be, you know, $500 for each notification that you send out. The other billboards, emails, magazines, newsletters, newspapers, radio, social media, TV, and website. And on the taxonomy, there's more detail, but I'm also giving y'all like an instruction guide that really kind of answers all the questions about, well, is this social media or is this a website, or, you know, what you need to select, and kind of how to look at it and answer any sort of, you know, questions like, well, if I run the billboard for more than 1 month, do I only get paid for the first time that it's run? And even though I'm having to pay for it month by month, it will kind of solve all of those issues for you. And I will go ahead and show y'all now what the STARS report looks like that you will submit. So since we were just on the media outreach, and this will all be online. And like I said, you can have more than one reporter. I'm happy to set up as many team members as you want, but I do want to get, one person at least. Like when you email me and say, hey, I want to participate, I just need the name, position, email address, and contact phone number for who you want to be your MIPPA team leader, so that I can set up their STARS account. And they can, go in and at least be able to pull it up and look at it as I'll go through the training. So for every media outreach and education event, everything with a red star is what is required in order to successfully submit it after you have entered the information. And if you look, you see, you go through and you say who did it, the time spent, what you called it, the type of media, and you select just one of those. Then in this target beneficiary group, multiple of these can be selected, and there is an other category or an NA category. But really, if you want to put more specifics about the target group that the media was directed to, you can always enter other and then enter additional information at the end. And the big thing for all of these units is selecting the topic that the media, the event, or the contact discuss. So there's a long list of topics, and I also sent y'all, and we'll send again at the end of this, a job aid that gives really good, easy to understand definitions of every single one of these topics, so that if you're unsure about whether it sounds like it's about Medicare savings program or whether it's about Medicare fraud and abuse, you can see what they mean by those definitions. And that is actually all that you have to do. You enter that on STARS, and then it will report it to me. The group outreach and education form is very similar. It has pretty much the same, it's asking you the same information. And I do want to kind of draw y'all's attention to, in that target beneficiary group, one of our performance measures to ACL is kind of the specific groups that they kind of, that usually are reached last, that they want us to target. They will track how many of those. So that would be anything from minority, low income, rural, and English not as a first language. And yeah, you can select multiple of those. If you are unsure about whether or not it is rural or not, I'm going to send y'all a list that provides all of the parishes and subdivisions within each parish that qualify as rural. Usually the general definition is it's an area with 50,000 or less population. So a lot of y'all will qualify as rural. And also if you enter, if you conduct an event or do media in an area that, even if your agency is located in a non-rural area, if you perform activities or do an event in a rural area, then you will classify it as rural. And that really is more for my tracking and for ACL to make sure that we're kind of reaching the populations that we know need the most assistance or have the most trouble getting enrolled, know the least about Medicare. And you have the same topics again down here for what the event kind of focused on. And also you can select multiple selections for that. But both of these will be $500 for every successful form submitted. And if you have any issues along the way, entering the form or questions about any of it, I will be happy to meet with y'all and kind of figure out any questions that you have. For the group outreach and the media, there is one, let me pull it up for y'all. There is one manual section called Group Outreach and Education and Media Outreach and Education Forms. And it really walks you through, I mean, step by step by step, and answers sort of specific questions about, you know, what to do where and what counts and what doesn't count. And this will also be sort of reviewed in the training, but I found the manual to be really easy to understand and read, and it even gives you sort of explanations for any validation errors that you might run into. So if you submit your form and it gives you one of these errors, like you didn't put total time spent, you didn't put a title, it's going to trigger you and give you a validation error. And this is going to go through all of the errors and how to solve them. Although most of them kind of seem pretty self-explanatory, I know, you know, that when that happens, it is frustrating, and, you know, y'all don't want to spend a whole bunch of time trying to fix something just to get to work. So if you aren't able to get the form submitted and you spend more than 30 minutes working with it and are still having issues, call me and I will help you fix the problem. That way y'all are not, you know, I know that this is going to be somewhat of an administrative burden on y'all. And, you know, that is part of why we raise the unit cost, to kind of capture that, you know, you're having to have staff spend time understanding the STAR system and, you know, entering forms where in the past you were just doing it on paper. I think once y'all get used to it, it will be a lot more user friendly than having to, you know, send off invoices and do all of that. And also, other than our ADRCs, like, you are not going to have to bucket your funding for me. So you can conduct as many outreach and education events, media activities, and your beneficiary contacts as your maximum contract amount will absorb without limitation. So if you know, only don't want to do any media or, you know, group enrollment events or anything like that, you just want to focus on one-on-one beneficiary contact, you can do that. You can earn all your entire contract at $100, at $100 a unit. And what numbers that I get each month, all you have to do is enter the form, and that is it. Everything else will be handled on my side. And yeah, so the other part, going back to showing you what the forms look like, is the beneficiary contact form. And it is, you know, similar, but it does have a little more detail in that it is not required that you get all of this information about each beneficiary, but you know, if they are willing to provide it, and all of this information is confidential. It is, you know, in an encrypted, protected system that no one will have access to, which is one reason, you know, why sort of getting your team member set up is you'll kind of see kind of an involved, unnecessarily drawn out process, but that is the purpose, that you know, they have a contractor that handles security for it outside of ACL, and they ensure that any of the information that you put in here, the only thing it will ever be used for is both for me to figure out what you need to be reimbursed, and then for ACL to report back to Congress on the statistics. None of that other information will ever be accessible to anyone, especially to Medicare providers or vendors or anything like that. So in case you have clients that are, hesitant to participate because they don't want their information online, this is not stored in sort of an online accessible like database that even someone could hack into. So there really is, they have a lot of guardrails in there to ensure that no one's protected health information is vulnerable to bad actors. So all of this stuff at the top is just demographic and identifying information about the beneficiary that you are conducting the one-on-one contact with. And there are a couple of other things on this one, including how they learn about your program. And I mean, that can be, and I definitely know in some cases other is going to be the answer here. But if they just say, someone told me about it, that's even fine. But we are trying to see what the most effective ways of promoting your program is. So to see how someone got to you from and from what information is really helpful. And you can see select the method of contact, which is phone call, mail or fax, email, face-to-face at a site or event. At an event site, and then web-based. And your web-based is going to also encompass text messages and alert media, anything like that where you're on a messenger or it is not a phone call but done through the phone. It's kind of a good way to look at it. That is what you will select there. Then age group, gender, race, language, and all of that is kind of self-explanatory. And then the topics discussed is really going to be kind of your the meat of what they are looking for. So in the job aid, there's definitions for all of these topics, and I will also be providing y'all with sort of best practices from other states and a whole bunch of tools that they provide that kind of will help you. Like, let's say you are not really aware of like how the appeal and grievance program works with Medicare. Well, I have a quick one-page guide in case someone calls with that and it's a topic that you don't know any information about. You can really quickly go and look. We also have access this year for each one of y'all to both the Medicare Plan Finder, and there is a direct link if you go here at the top where it says send to CMP. So if you get a call and this is about fraud or a mailing received with misleading information, anything that the Senior Medicare Patrol would be interested in or should handle, you enter the information on here, and when you click yes, send to SMP, SMP will pick up that file, contact the senior, or figure out where the contact came from. A lot of times they get emails, phone messages, text messages, and tons of mailings that are not from Medicare, not from their selected Medicare provider. And we want to make sure that there's no potential fraud going on and stop it where we can. So, I know I've already had 3 calls this week from people that received, a text message telling them to call this number, that they no longer have to pay a premium on their, it doesn't end. And seniors are so vulnerable because they just are not used to getting the 10,000 emails a day that we kind of all get from different people. And so they take everything that comes to them seriously, and we don't want any of them falling into a trap where they do anything to put their money, their enrollment status, any of that at risk. And the senior Medicare patrol folks are really good. I met with two of them over the summer at the MIPPA conference in New Orleans, and they are even willing to come out to y'all's agency and sort of give a talk which you can use as a Medicare event for your MOE or GOE, and we'll kind of do a broad discussion that you can have for your seniors where they talk about different examples of fraud, what to look out for, like who to report it to, and that I have found that their discussions are really interesting because they always have some crazy stories, and it's just last year I heard something that I actually saw it in practice, and it's they do really good work over there. And I know we see how many people are trying to get into the pockets of seniors and take advantage of them on a daily basis. So let me know if any of y'all would like me to kind of liaison you to them for them to come out and speak, or come out and train your staff or anything like that, and I'll be happy to connect y'all. Just as we had for the two group events units, I have a guide for the beneficiary contacts, and it does the same thing. It will go through step by step every part of this form. I'm trying to look and see if there's anything that I feel like y'all would be. The gender identity part, you are welcome to put prefer not to answer. I know that many seniors don't want to be asked this, or don't understand even what you're asking. And yeah, so if unless they tell you, you can put I prefer not to answer, and it is the same thing with sexual orientation. I'm going to host a training for y'all coming up in a few months on sort of how to handle these issues in a way that does not offend your seniors, but also will capture their status as one of these minority target groups. And it's that they are starting to require us to get that information for everything that y'all do, but I want to help y'all figure out a way to do it that is as painless and non-offensive as possible, and that isn't gonna cause issues getting any other information from the client. And trying to think of anything else. Okay, so I will also starting next week, actually I take it back, week after next. So I will have Thursdays. It's gonna be exactly what I did here. So if you're here right now, you definitely don't need to re-attend the one on Thursday. But that will be at 1 p.m. And then starting the week after Lakota, for any of y'all that are going to Lakota, I will also be doing, I have a presentation during Lakota, and it's going to be about MIPPA also. It will be recorded and posted online for y'all. So anybody that's not able to go to Lakota or that wants to go back and rewatch it, it will be there. But the week after that, I will start holding anybody that was here during the area plan or needs assessment. I call it office hours, where I just kind of open up a Zoom call that any of y'all at any point during, the 2 hours can drop in, ask me questions, talk to me about any issues you're having, resolve anything that you have going on. And obviously it is completely voluntary. If you don't need me and I'm not going to waste your time, but, even if you just wanna, drop in and, hear what other agencies are up to and get ideas of what you can do, that will be, and I believe it's gonna be on Thursdays, but I will send y'all, there will be, one link that stays the same the entire time. And so that'll be for 2 hours once a week, unless y'all need it more often than that. And if you need to meet with me individually and you're not available during that time, I'm gonna send you a link that you can schedule an appointment with me that works on your schedule. And I will zoom in and we'll get you resolved with any questions or issues you're having. And I believe I'm going to open y'all up for questions. I know, like, with a lot of the specifics on this, the training is going to really get into like the nitty-gritty details with y'all about like what, most of this is pretty self-explanatory, but you will run into some issues. It will also provide you with really, up-to-date, easy to understand, like, information that has changed from prior years with Medicare or is new, including just the basics about Medicare, including, the savings plan, advantage plans, just so that anyone who is really looking at this for the first time and hasn't ever had to learn anything about Medicare, you can have a good sort of base to work off of. And the required training is really so that ACL wants to know that each agency has a certified person, and you will be certified as soon as you finish the training. And that way, they know that there is at least one person that has had the up-to-date training and that the information they're giving is as current and correct as possible. I will also be sending y'all a link to a webpage with all kinds of resources, including, templates for media outreach and best practices and just a lot of things that I think make what y'all need to do or what you can do a lot easier, based on what they're doing in other states and in other regions and what's been successful in the past. And to me, without y'all having to spend any money, because really I want y'all to net benefit from this and have the MIPPA money, because once it is earned, y'all can spend that on whatever you want to spend it on. So if you got your preliminary funding amount and you're like, I really don't think we can meet that level, reach out to me. So that's email me, call me, text me, and say, look, I'm really concerned that it's going to require this much work. We don't think that we can meet that, but we would be able to meet fill in the blank. And I will work with you. Like I said, even if you're only doing one event, let's say, just having you participate at all is really success for me. And I think as we go and you can see other agencies successfully going through it, we will have greater participation. But I will really work with you to make all of these units flexible to any activities where you are spending staff time, resources on providing Medicare and or health prevention information to seniors. I will help you figure out how to get it to where that qualifies and you can get paid. And right now we are at open enrollment. So, you'll have some months here where you will likely be receiving a lot of calls into you, even beyond what you do in outreach. So, yeah, I'm excited to get y'all started, but I will open it up to y'all for questions. And I think I have y'all to where you can unmute. Oh, wait, let me look at the chat. Okay. Oh, no. The effective date is going to be November the 1st. And that's going to run through June the 30th. You're going to get the contracts. So as soon as each one of you tells me I'm accepting the contract and I want to participate, I have already drafted the contracts to release them to the contracts grant reviewer. So the faster y'all kind of email me and let me know, yes, I want to participate, and put your agency name, because I know most of y'all just by your name, but in case I haven't met you yet, put your agency name and say, yes, I want to participate, and give me the name of your team leader, and I'll release your contract to accounting and finance. And now you can actually go ahead and get started. Like once you tell me that you are agreeing to participate, even before your contract is approved, because the payment won't start until the next month when I check it the first time, but y'all can go ahead and get started on November the 1st, regardless of where the formal contract is in the approval process. But okay, the training is actually is going to be on your schedule. They are all web-based webinars, and most of them, I haven't looked through every single one of them. Most of them are between 30 minutes and an hour, and I want to say there's like 8 of them. I'll have to go look again. But once I get your team leader enrolled in STARS, you will then have access to the training. And you don't necessarily have to complete training before you start the program. I think it will probably help with reporting, but you definitely you don't need to do the training first. We just need to have you certified before the end of the year on June 30th. If you already have a STARS account, we will, I believe because Monica, you're participating with the, why can I not think of the name, with the
Department of Insurance.
Yeah, thank you. So I am fairly certain that I will repurpose one of these at the bottom, the special use fields, and you will put GOEA in there. But I will absolutely get back to you when we get done here and let you know how to do that. All of my ADRC folks, y'all are gonna have one additional meeting with me once, because y'all won't get your contracts until everybody else has told me they're participating or not, just because you're gonna, inherit any of the funds that they don't accept. But I will also discuss with y'all the Part D segment of your contract. But that will be, I'll send y'all an email later this week. But Monica, how do you find STARS difficult to use?
So it's not difficult. It's I mean, basically the same thing you explained from what I remember, Jessica. Laphilia's on the line. She works more with it every day, but it seems like it's the same information, just making sure you click all the boxes that apply and filling in the information.
Sure. I mean, I didn't mean to put y'all on the spot. I just, for anybody that's like nervous about going into this, that, it's a new system and it's not the way y'all have done it before. I just, wanted to alleviate your fears that this was going to be a big hurdle to get through. And, yeah, but, so anyone else Thank you, Ophelia. Ophelia says it's the same. It's not difficult, it's just detailed. If it were me, I am happy to not have 75,000 sheets of paper that I've got to keep up with and send somewhere and scan somewhere. And also it is going to allow me to pay y'all monthly, and since it's going to get wrapped into accounting and finances regular payment schedule, you're not going to be, because I know at the outset I had multiple people contact me and say, okay, we will be interested in doing the program again, but the payment structure that we did last time, we were waiting, months to get paid, and that is not tenable for me, and I know it is not for y'all. So yeah, I spoke with accounting and finance and said I just want to make sure that they can get paid as quickly as possible after they have completed the service, and where y'all can't get paid, for each unit as you do it. Monthly, I think puts just a minimum amount of time that you have to wait from when you completed the service to when you get paid. Any other questions? Oh, sorry, y'all, did not see, but I think Sharon must have realized how to mute herself. Yeah. Any other, so only the person that does shams? No. You can have as many people as, even if you have somebody that only kind of minimally participates in doing MIPPA contacts, they can do the training and they will also get paid if they complete the training. So there's no limit on the number of people that can both do the training and or be a reporter. So the STARS account, there has to be one per agency, but you can have more than one person for each agency be a reporter. I'm going to start y'all with one per agency because that will, and that the first person that you make, sort of your team leader in STARS, that person should complete training. If your main reporting person is not, the person that you want to do the training, we can put them both in there, but you are not limited to only one per agency. And you don't have to all share one login either. If you already know at the outset, like you have 3 people that are all going to do reporting, send me all 3 of their names, contact information, and just designate which one of them will be the team leader. And that really, there's no, additional obligations to being team leader or anything like that. It just, designates one if there's multiple reporters that will always have access and, right. So, and really, even if, you have someone that participates, 2 hours a week answering phone calls, you can either have them have their own STARS account, which again, I think it's good just to, be able to see the system and get used to it, but they can, and you can do it while you are doing the contact, or, if you just want your team leader to submit the information for everyone else who's participating, you can do it that way. It's really kind of up to y'all. STARS does not actually operate on the WellSky platform. STARS is a system that was designed by a contractor called Booz Hamilton. And it is, let me tell you what the acronym stands for again. It stands for State Health Insurance Assistance Program Tracking and Reporting System. So there are multiple ACL and ACL in both in the federal Department of Health programs that operate on stars and report on stars, both the MIPPA grantees and SHIP itself is actually an entirely separate grant that for our state is run by the Department of Insurance. So they also report in stars, and the Senior Medicare Patrol reports in stars. And that is the sole use of the platform. Anyone that is paying anyone to provide MIPPA services has to enter the data in stars, and that is their only grade of our performance, is based on what, you know, is submitted in there. So as much as, you know, I want to get y'all paid for every minute that you're spending in the program, it also, you know, directly reflects on our performance, especially compared to other states. And they really look at how much you're covering the entire state, how much you're reaching those especially vulnerable populations, and the number of contacts that you're having. So I think that we can get back to where we've got the whole state kind of covered. And I want to do, you know, whatever possible to make that as easy and painless as I can. What about people that begin to call Part D now? You'll be able to, so Monica, y'all can, you can go ahead and do everything under your contract. The only reason, and it, as soon as it is approved, it will be retroactive effective to November 1st. So the only reason why I am waiting to issue the paper contract to you until we know, you know, who in your region is participating or not, is because we would have to do an amendment. Like if there's additional money that needs to be added, we would have to go and do an amendment and do the whole process over again anyway. But November 1st, you can start. Once you have told me that you are agreeing for your agency to participate, you have done, you know, you have made the agreement. Whenever the contract is actually approved by OSP, you know, which could be into November, depending on how long it takes our new contracts and grants reviewer to do it. But I am hoping that everyone will be approved, you know, long before the first payments go out, or scheduled to go out, which would be, you know, the first week of December. So yeah, any you can consider your contracts are in effect as of November 1st. And yeah, and that is for everyone, that as soon as we get to November 1st, and I'll confirm with you when you send me the name of the person, when your STARS account, you know, is up and accessible. And really, once that is open, once November 1st hits, you are good to go. You know, if you haven't let me know your person and I haven't gotten them in there, like, obviously you won't be able to report it. But yeah, I'm hoping, and I will also be, you know, in person at Lakota in case, you know, we get anyone set up and you're having trouble logging in or anything like that. And I'm gonna actually see if they will let me bring y'all's paper contracts to kind of avoid the delay of sending it back and forth. But I will let y'all know about that. Yeah, hopefully since I have the whole thing drafted, she just has to enter it into the system. I'm hoping that the, you know, wait time there will be fairly short. but it is sort of the most involved one of our contracts that we put out for y'all. So it always is taking kind of more time to prepare than the other ones. So Part D individuals being today are able to be counted. Okay, November 1st, they'll be able to be counted. If that makes sense. And that is solely because ACL was late this year actually getting the grant applications processed. So it's going to be until November 1st for the money to drop for accounting and finance to pull it down from the feds to be able to pay y'all. And so they can't put the contract in the system until there's money there to pay it. Or I will ask Laura if November 1st was the earliest date, and if we can do it earlier than that, I will make it as early as they are able to issue it, and I will let y'all know later today. But also I'm gonna put a link in the chat for y'all where all the documents now you don't really need these forms because you're going to be filling it out online. It really was just there so that I could show y'all what it looked like. But all of that is saved in a folder. Give me 1 second to get to y'all. I'm going to put it in the chat. It's also going to be emailed to y'all. It's the same thing that that was attached to the email, but is there, if later on you don't know where you put it or saved it. It will be there okay, so if we help someone today, they cannot be counted. Correct. If unless I can make it sooner. Today's the 15th. If I can move it up, and Laura will be able to tell me that. I'll go ask her as soon as we get done with the meeting. If she is able to make the start date earlier than November 1st, then y'all can get started as soon as whatever the earliest date is. I wanted to do October 1st, to match our old contracts, but she said it was not available. So, yeah, if I will ask her if the 15th would work. And she'll check and see if the money is dropped yet. And if so, yes, y'all can go ahead and get started. Any other questions? And I don't want to keep y'all longer. I didn't mean to talk for an hour, but don't hesitate to reach out to me if you have any issues. And I'm really excited, for y'all to get started. And thank y'all for sharing the time with me. I know y'all are all busy and we appreciate everything y'all do. So with that, I will see none of y'all on Thursday, but hopefully some of y'all at Lakota. And y'all have a good day.